Ladies and gentlemen, good evening. I think we're ready to start the program this evening. So again, welcome, good evening to Mackenzie Health's community consultation on future hospital development. My name is Lou Greenbaum. I'm chair of the Planning and Development Committee of the Mackenzie Health Board of Directors and a member of the hospital board and executive. On behalf of the board and all staff, physicians, and volunteers, I thank you for taking time to be here tonight so that we can share with you our progress in the planning of significantly expanded and enhanced hospital and healthcare services for our community. Once we have shared that update, we look forward to receiving your thoughts, questions, and suggestions on our proposed plans. I would like to introduce to you members who are at the, I guess we'll call it a head table. We have on your immediate left, we have Mayor Maurizio Bevilacqua, City of Vaughan, who will be more formally introduced in a moment. We have Dr. Nicholas Vadouris, Medical Director, Chronic Disease and Seniors Health. We have Dr. Peter Strohs, Medical Director, Diagnostics and Therapeutics. And next to him, at my extreme left, we have Altaf Stationwala, who's the President and CEO of Mackenzie Health. I also want to welcome Linda Ball, who's standing next to me, who will be our sign language interpreter for the evening, so that deaf and hearing impaired members of our audience may also share in the information provided and the opportunity to contribute their thoughts this evening. In addition to staff and physicians who will be updating you on our progress, we are pleased to have various local dignitaries here tonight to speak to their support of this project. I would now like to formally introduce and welcome a very dynamic individual who has had a long and distinguished career of public service to our community and continues to lead the City of Vaughan through his strong vision for the future. He's a member of the Mackenzie Health Board of Directors and also sits on our Planning and Development Committee. Please help me in welcoming Mayor Maurizio Bevilacqua.
Thank you so much, Lou, for your very kind and generous introduction. I think that what you're witnessing tonight is extremely important in community building. As you know, Mackenzie Health plays an important, very, very important role in building a new hospital here in the City of Vaughan. You know, I want to first and foremost express my gratitude to the over 300,000 residents in the area who strongly support a new hospital in our city. You know, this community is a community that has been waiting for our hospital, and every conversation I have had with, whether it's the Premier or ministers or indeed individuals that are involved in the planning of the hospital, leaves me very optimistic about building this, what I think is a very important anchor in our city. And I know that we've had incredible, great news here in the City of Vaughan. You know, we lead York region in job creation. We have incredible economic growth. We have a subway coming. We're blessed beyond our wildest imagination here. We're doing exceptionally well here in the City of Vaughan. But I do think that the hospital is a very important plays a very important role in really establishing the essence of what the city is truly all about as well. There's a lot of work being done over the years, and I want to thank everyone that has been doing that. But I thought that as mayor of the city and also member of the board and planning committee, I thought it was very important that we gather together as a community to get your input, but also to give updates. Because it's very important to get the real story about what is occurring in the development of the hospital. The real facts, the real figures, the trajectory that we're on, and how we we are moving forward on this extremely important project for our community, and to also seek input. Input is extremely important because input will help us shape the type of hospital and health services that are required in our city. And there are really no better ambassadors of a hospital than the citizens of the city of Vaughan. And and everywhere I go throughout the city, and I'm out and about quite a bit, I speak to a lot of people. There's a great deal of enthusiasm, but there's also a passionate belief that the time has come for the city of Vaughan to have a hospital. People are buoyed by and very optimistic given the many statements made by premiers and ministers in this province, the strong support that this project enjoys with the provincial government and with the municipal government as well. We are doing, at the city, we are doing our very best to make sure that this project goes well. We have a development facilitator. We have established a committee with the hospital to facilitate the development, and things are going exceptionally well. There's a great deal of cooperation and commitment, which augurs well for a successful completion to what I believe to be a very important part of the future of this city. So to the thousands of people who I've spoken to over the many years, who have always indicated their desire and need to have a hospital in this city, I want to thank them for their input. And in many ways, we are today in this incredible position to see the realization of a hospital largely because of the incredible support that the community has expressed day in and day out throughout the process. It would not have been possible had it not been for the support of the community in financial terms, but also in terms that speak to a higher purpose, and that is civic engagement, people who believe that it's the right thing to do, people that believe that there is a need, and people that truly are in it for the right reason, and that is to provide a very important element to our city. And I must say that everywhere I go throughout this city, and to put it in perspective, last year as your mayor, I participated in over 450 events. And every single event I go to, I tell the real story about the hospital, and that is that the hospital is on its way. We need to be focused, we have to maintain focus, and we have to look at the ultimate goal, and that is to provide a very important part, a very important institution to a city that needs it, and that is the new Mackenzie Vaughan Hospital, which will become a reality. And as you will get a report today from a number of individuals, including Ataf Stationwala, we will get the real story about the real progress, the real commitments that have been made, and how we're going to move forward together and make our dream a reality. Thank you.
Thank you, Mayor Bevilacqua. Your support and passion for our city and the future Mackenzie Vaughan Hospital are indeed very much appreciated. We look forward to your continued support as we move forward in the planning of future healthcare services for the people of Vaughan and Southwest York region. It is now my pleasure to begin this evening's presentation on our planning efforts to date. Mackenzie Health, which, as you know, as what was York Central Hospital, is the rebranded York Central Hospital and is a new regional healthcare provider that was launched in June of this year. Our vision is to provide a world-class healthcare experience for our patients and our community. Mackenzie Health will provide care through a unique two-hospital model of care, which will include Mackenzie Richmond Hill Hospital, as well as the future Mackenzie Vaughan Hospital. To ensure that we provide the most efficient use of taxpayer dollars, Mackenzie Health will have a single governance structure and a single administration overseeing both hospitals, as well as a network of community service locations. I certainly feel privileged to be part of the board of directors at Mackenzie Health and to have the opportunity to contribute to this very important project, which is essential to the expansion and enhancement of healthcare services in our community. Board members are volunteers who come from many different backgrounds and bring many different skills. The board plays a crucial role in providing strong governance and oversight to senior management and operation of Mackenzie Health, so we can offer a world-class patient experience to the people of our community. This is a big responsibility which we take very seriously. Under the Ontario Public Hospitals Act and the Corporations Act, the board has the legal and management responsibility for the existing Mackenzie Richmond Hill Hospital, as well as the future Mackenzie Vaughan Hospital, for which it is accountable to the Ministry of Health and Long-Term Care. The board also oversees the development of an annual hospital service accountability agreement with our local health integration network, which administers and oversees the many hospitals within what is the Central Lynn area. This agreement details the services we provide to the community with clear and well-defined service and budget parameters. The Mackenzie Health Foundation is a separate entity and is responsible for fundraising in both the Vaughan and Richmond Hill communities and welcomes donations which can be directed at either hospital or to the organization as a whole to provide the funding that is absolutely essential to creating a world-class health experience. The Mackenzie Volunteer Association, did I miss something? I'm sorry. The Mackenzie Volunteer Association also enjoys broad support from both the Vaughan and Richmond Hill communities, with members from 16 years of age and up who generously donate their time and raise funds to help serve our patients and the community. Mackenzie Health also has strong municipal, regional, and provincial funding and a solid foundation upon which to grow healthcare services to meet the current and future needs of our community. Our development project enjoys the widespread support of many members of our community, including our elected officials, some of whom are here tonight. Just making sure. Our vision and commitment to our community is to create a world-class health experience. That means providing the very best patient care experience by providing high-quality, safe, and accessible care. That also means growing strategically by ensuring that we provide the right service with the right partners delivered by a top-notch healthcare team. It also means providing that care in a financially responsible manner that ensures that we are making the most efficient use of our resources. In addition to the Mackenzie Richmond Hill and future Mackenzie Vaughan Hospital, Mackenzie Health also offers a wide variety of healthcare clinic services at 2 locations in Vaughan, 2 locations in Richmond Hill, and 1 in Barrie. Among the many vitally important services provided at these locations are dialysis, mental health, diabetes education, preschool autism, and brain injury services. Together, they form a valuable network of healthcare in our community. I also should mention, and I neglected to do so, we have also with us tonight our Chief of Staff, Dr. Eric Fonberg, who's not at the table, but sitting there. The close and unique proximity of the Mackenzie Richmond Hill and the Mackenzie Vaughan hospitals enabled Mackenzie Health to take advantage of their combined patient volumes to deliver a new and exciting caliber of care for the people of our community. hope you enjoyed our video and its message. I just want to acknowledge that local councillor Marilyn Iafredi has just joined us, and she's sitting out here. It's now my pleasure to introduce Mr. Altaf Stationwala, President and CEO of Mackenzie Health.
So thank you. It's my pleasure to be here. This is, I think, our third community engagement session we've had over the last number of years. It's our pleasure to provide you further update on the progress of our planning in Southwest York Region. So as much as we're focused around the future, we do know that we must still focus on the day-to-day operations of the hospital. So as we grow, we know we need a solid foundation of good clinical care and an efficient delivery model. Every year, the hospital submits what is called the Quality Improvement Plan to government. This plan is focused around a number of key initiatives around improving quality of care at the hospital and ensuring that we deliver high-quality services. This plan becomes the focal point every year of all of our initiatives, whether they're around looking at infection rates or looking at mortality and morbidity rates. These are fundamental to ensuring that we continue to improve our services. As well, internally as an organization, we also develop three key objectives. We call them widely important goals, or WIGs, and the entire organization embraces these three key priorities. The board holds management accountable to delivering on those accountabilities, and I'll speak to those specifics very shortly. The other major focus of our organization is around leaning. So leaning is a new concept in healthcare, although it's been very much embraced in manufacturing for decades. We've taken the approach of trying to eliminate waste to ensure that we can meet the needs of the growing community without necessarily adding incremental dollars. And over the past number of years, we've found almost $9 million from our operations by leaning out a number of our processes and our systems. So one of our WIGs, and one of our most important WIGs, is improving patient satisfaction scores. About 1 in 5 patients that's discharged from the hospital receives a questionnaire from NRC Picker. This is a standard survey that's used across the province, so all hospitals use the same survey methodology. There's a question at the end of the survey that says, would you definitely recommend your hospital? So in this case, would you definitely recommend Mackenzie Health? So we're tracking this over the last number of years, since 2006, and you can see a gradual trend upwards. Our target is to get to 75%. So 75% of patients would definitely recommend Mackenzie Health to a family or a friend. Now, the number one issue around patient satisfaction tends to be communication. So patients don't know what's going on, they don't know what the next step in the care process is, they don't feel appropriately prepared for discharge. So on the left-hand side, you see some of the tactics that we use to improve communication. So we have daily manager rounding. That means that the manager or the supervisor on the unit will round on every patient and every family member to ensure that their needs are being met, or if there's any gaps in service delivery, they can be addressed in a timely fashion. We also know that discharge is a very crucial point in the care process. So we ensure that we now have a standardized discharge checklist so that every patient knows what they're going home with, the things that they have to take care of, appropriate coordination with the CCAC or any other community-based services. So again, there's a clear transition from the hospital. We also do discharge phone calls. So this is for high-risk patients to ensure 24 or 48 hours afterwards, we're following up to make sure, for example, they're taking their appropriate medications, or if there's been any complications, we can direct them to the right place to get additional care. So these tactics that we've been doing for the last number of years, we've already seen a 7% improvement year over year in this measure. So this is very important to us, and we know we can do better, and our goal is to continue to move this number up to 75%. Another one of our WIGs, or widely important goals, is the waits in the ED. Those of you that have had an opportunity to use Mackenzie Health or any hospital in the province know that the waits in the ED is the most challenging component of our care delivery model. And those waits are most pronounced for patients that are waiting for a bed. It's multifactorial. There are many issues around why beds are difficult to come by. One of the biggest challenges is the fact that on any given day at Mackenzie Health, 50 to 60 patients are waiting for another level of care outside of the hospital. Now that's a challenge we're working through at a system level. But despite that, we know we can do better even with those external challenges. So we've made a significant effort to reduce the wait. So you can see this is being tracked over the last number of years. Our peak was almost 56 hours to get to a bed. We're now below our target of 38 hours. And in fact, I can tell you this last month, we've been in the high 20s. So this is putting us on par with all the other hospitals in the province. Our challenge continues to be the growth. So as much as I can say we are paying attention to this, every year we've seen an increment of 5,000 additional visits to our ED. So that's about a 5 or 6% growth rate to the ED. So we're going to see over 90,000 visits this year in the emergency department at Mackenzie Health. So obviously, greater reason for the new Vaughan Hospital coming online. Another key metric is our financial position. And about 2 years ago, we were in some financial distress at Mackenzie Health. We were forecasting a $12 million deficit. Over the last number of years, through leaning and other process improvements, we've been able to reduce our expenses and bring our budget back in line. So these two charts demonstrate our operating position. We are in a surplus position. That's 2 years in a row we will be finishing with a small surplus, as well as our cash position is quite solid. We have $35 million in our net cash position. So we have no debt, we have no deficit, we are financially sound to take on the additional challenge of growth and the new Mackenzie Vaughan Hospital. Other important achievements. We know nursing is the cornerstone of any hospital, and we were very pleased this year to receive an award, a Best Practice Spotlight Organizational designation from the RNAO. And this is a significant designation. We're the only hospital in the Central Region to receive this. It is based on ensuring that we meet some very significant best practice standards around clinical guidelines. So again, a lot of effort to do that, and we're very fortunate to have received that designation. As well, we've also been provided the Behavioral Services Ontario mandate for all of Central Lynn. So we are growing mental health services quite significantly, and we're the lead organization to do that. We're also in a leadership role for stroke care. So we, through our York Region, are the district stroke provider, so we provide outpatient services in Markham-Stouffville, in South Lake, and in other community locations as part of that stroke mandate. So that's what we're working on today, because what we work on today will ensure that our future is very successful, and we have a solid foundation of good clinical care to add additional volume, and in particular, to bring online the Mackenzie Vaughan Hospital. So the obvious statement is around the population growth that we're facing. And clearly, no single site can accommodate this amount of growth. Over the next 20 years, we're seeing 35% growth in population. The more challenging component of that is if we straight line that for our seniors and our aging population, that's about 140% growth in projected activity. So we know we need to relook at services, and we know we need to grow services quite extensively in Southwest York Region to meet this significant demand of services. And we know that with a greater critical mass of 2 hospitals, we can provide a broader range of services that will be more specialized in nature. Now, we can't do this on our own. So as much as we are the hospital that's leading the planning and the ultimate operation of the new Vaughan Hospital, we have the support of the provincial government. We have the support of our Central Lynn. We have the support of Infrastructure Ontario that just got involved with this project as we've now moved into stage 2 and are moving into stage 3 of the planning process. The City of Vaughan is a key partner. The Region of York through their funding allocation for hospitals, and obviously our foundation to help us support us in raising that local share and that community contribution that's very much vital and fundamental to delivering this project. Now, as I've said to you before, this is our 3rd major community engagement session, but we do a lot of other types of activities. So as we're here today, we're in an open house. We do online surveys. I have a President's Advisory Council that meets a number of times during the year with residents from both Richmond Hill and Vaughan that provide guidance and advice on some of the things that we're doing. We also have our staff and our volunteers and our foundation members, as well as our physicians, many of whom live in this community and who are very much connected to what's going on and engage the community where appropriate. We also do, and you'll see in your in some of the material we provided, we are of the mind of doing engagements in people's locations. So for any group that wants us to come and meet with them and tell them about the things that we're doing at the hospital, we're very much open to that. And we've met with a number of religious groups, ratepayers groups, service clubs, and you can see the list of others that we've consulted with. Now, as we start to look at planning for the future, there's some sort of framework that we need to look at how we distribute services across Southwest York Region. And we want to ensure that whatever we do, whatever we create is sustainable into the future. So the dimensions of quality, accessibility, affordability, flexibility, and as we're doing today, engagement are fundamental to any changes and any enhancements that we make going forward. And the dimensions of this are things that the board evaluates as we make decisions around growing services, around realigning services, It's fundamental to ensure that we have a solid framework to make the best decisions for our community. Now, the exciting part that we see with two-hospital model of care is the fundamental growth. The Mackenzie Richmond Hill Hospital is unable to grow because of some restricted footprints that we have, and the reality is the Vaughan Hospital provides that ability for the next big growth spurt for Southwest York Region. As we're doing our planning, and this really reflects the operational capacity that gets achieved close to the opening of the Vaughan Hospital, these are some of the percentage growths that we see. Now, clearly, as we build the Mackenzie Vaughan Hospital, we're going to be building flexibility for even more growth than is suggested here. But this just starts to give you a flavor of the incremental growth that we would see happening as we move forward with this project. So 70% more acute care beds. So that's in areas like obstetrics, pediatrics, med-surg beds, and mental health. 39% more surgical procedures, 50% more critical care capacity, 55% more rehabilitation and complex care beds, 36% more increases in diagnostics, so that's labs and medical imaging, and 31% more growth in ambulatory care and outpatient care. So that's a significant growth that will help us deal with the increasing population and aging population that we see coming into this community every day. Now, as we've communicated before, we see a two-hospital model having core services at both hospitals and specialized services at the hospitals as well. Both hospitals will have full-service emergency departments, surgical programs, intensive care beds, medical surgical beds, and clinical supports such as medical imaging and laboratory services. We also see an opportunity with the critical mass that's created through two hospitals to start to create bigger and more robust programs at each of the individual sites in things like birthing and pediatrics, rehabilitation, mental health services, and continuing care. We also see further opportunities of enhancing our regional programs. So the two designated programs that we are designated by the Government of Ontario are Chronic Kidney Disease and District Stroke Centre. The new program that we're in the midst of developing and growing is Seniors and Chronic Disease. Coming back to my previous comment about where the biggest growth will be in terms of demand for services. Chronic disease is the most challenging element facing our system, and our system is not well organized to manage chronic disease. It's very fragmented, and it does not serve these patients well. So we are in the midst, and Dr. Viduris will speak to this, in the midst of creating a more integrated program for dealing with seniors and those with chronic disease. Now, I'd like to turn it over to Dr. Strohs to talk about the first two programs that we really feel an opportunity to specialize in, and then Dr. Viduris will cover the next two programs.
Nice job up there. Okay, thanks very much, Altaf. You saw a few slides back, the growth planned in the York region. Over 150,000 people are planned to come over the next years. So what does that mean? Certainly there are going to be more families moving in here. We're planning to have over 3,500 new births per year. And with that volume, it's going to allow us to have many spin-offs and enhance our program. So right now, we do have a prenatal screening and high-risk assessment unit at the Richmond Hill site. We'll be able to leverage that and manage more complex patients. With the obstetrical patient, will not only have the opportunity to see the obstetrician with their complex condition, be able to see internists as well as specialized nursing staff to be able to more accurately and carry the child and mother safely to a delivery. So we'll be the only hospital, community hospital, that will be providing that type of service. With those births come complications. Not every birth is clean and simple. We'll be able to double the number of neonatal intensive care beds that we have. So the worst thing that any family would want is a child in distress. And even worse than that, if that child is shipped off downtown, then you have very little access to get to the child who are living up in the York region. So what we plan to have is specialized neonatologists. So what will happen is be what's called a closed ICU. So these are highly specialized physicians who will be able to look after these patients, keep them in the York region, keep the families close. And everybody is very anxious whenever they come into the hospital, even more anxious when they have to bring a child to the hospital. So we're conscious of those needs, whether the child is coming into the emergency department, whether they're coming into clinics, having an inpatient experience. So our goal is to try and make that as painless and comforting for the child. similar to the programs that they already have at North York and Sick Kids. With the new facility goes construction, which is fantastic. We'll be able to have private rooms for birthing. Families, they can have not only the mother, but another sleeping arrangement, whether it be the husband, partner, mother-in-law, mother, extended family, they'll all be in the room. Certainly with the similar finding with the children, private room for the families so that they can be closer and comforting the child in their time of distress. As the child is growing, obviously they're going to have problems or issues. We have fantastic pediatricians here already. We've got clinics involved with the emergency department, but also asthma clinics. We're going to enhance those programs for kidney disease as well as for GI problems, so that, again, all of the care will be able to be managed here and they won't be fragmented and having to send to other specialties downtown. We have 2 new minimally invasive surgical suites that are at our Richmond Hill site. And the goal and the future of medicine is into smaller and smaller incisions, microsurgery, and we'll be able to leverage those techniques to enhance the gynecological care of the women in our region. And lastly, that's that slide. Now, the next program is our District Stroke Center. Why do we care about stroke? We all know about heart disease and cancer, but stroke is the 3rd leading cause of death in Canada. So there are over 300,000 Canadians who are living with the sequelae of a stroke. We are the district care center for stroke right now. So patients who do arrive to our emergency department are treated with a life-saving medication called TPA, transmitogen plasminogen activator. So what that does when you inject it in the vein, it can break down the clot in the brain and increase the blood flow and hopefully minimize the extent of stroke and in some cases prevent the patient from going on to a complete stroke. So we have organized a very complex care model now into prevention, which is obviously the key. Nobody wants a stroke. But when they do have a stroke, to be able to manage them from the acute center through to the rehabilitation in the hospital and then progression back into the community. We've leveraged best case and best practices, not only in our hospital, but also transplanting that to the other hospitals in the region. So what do we see of the future? We see the future of expansion of the stroke program. Certainly with the aging population, this is not going to go away. We are coordinating the care both within the Vaughan site and in the Richmond Hill site. We see the acute treatment being here, and then as time goes on, moving over towards the Richmond Hill site, where the continuing care will go, and then the rehabilitation over there. We will be able to leverage and continue to leverage best practices to keep the maintenance of the best treatment for these stroke patients in our region, and continue to provide the best possible care for these patients in our region. And with that, I'll turn it over to Dr. Vituris, who's going to talk about the next areas of expansion.
Thank you, Peter. As was noted, I am the Medical Director of Seniors and Chronic Diseases at Mackenzie Health, Richmond Hill Hospital. I'm also a family practitioner in a clinic in Vaughan, and I live in Vaughan. So this is very exciting to me because I think that with the growth and development of our new hospital and the continuing upgrades of our existing hospital, we are going to create one fantastic system for our region, Southwest York region. And 2 of the things we're going to really develop great things are in mental health and seniors and chronic disease. With mental health, if I could have the next slide, please. Oh, I am the clicker guy? Okay. There we go. Thank you. Okay. Didn't learn that skill. In mental health, as it is right now, we have a beautiful unit at Mackenzie Health, Richmond Hill Hospital. It was built in 1974. It's been updated greatly by a family named the Peaks and many other numerous donors to the point where we're now at a 2012 level. We have excellent psychiatrists. We have excellent support services. I don't want anyone to think that we don't have excellent mental health services now. But what the expansion to the new hospital will allow us to do is to really have world-class health services. We'll be able to have 32 inpatient mental health beds. They will be regular beds. They will be intensive care unit beds. They will be Form 1 beds where patients who are a danger to themselves or are not really in very good shape can be monitored. We will have the best and most modern facility. We'll also have about 26,000 outpatient visits, 28,000 behavioral services visits, and 4,500 child and family services visits. We already have a great deal of these visits already, but by being able to spread to the two-site model, we'll be able to provide even more of these services. And if you look up here, you'll see numerous of the services that we will be able to provide. We do provide them to a certain extent now, but even by being able to have the space and by being able to have the increased resources, we'll be able to provide them better. And the two that I want to bring up most importantly are the new first psychotic episode clinic and the metabolic clinic. These are two very important clinics as we're growing and developing mental health. We realize that when a patient has their first break from reality or their first psychotic episode or their first quote-unquote breakdown, if we treat these patients immediately, quickly, get them involved in numerous programs, therapy, and medicines, they do much better throughout the course of their entire lives. And since much mental illness is long-term and almost lifelong in nature, if we can get to these people quickly and early, we can really make a significant difference in the lives of these people in our community and their families. In addition to that, if many of you are involved with some people who have mental illness, you know that we are giving them much more powerful medicines and they are doing a lot better for them. Unfortunately, a lot of these much more powerful medicines result in a lot of horrible side effects, such as weight gain, the development of diabetes, development of endocrinological problems or hormone problems. And we have now the ability to make one of these clinics to allow us to deal with all of these people, not only in their mental health status, but also in some of the other diseases that they get concurrently. So I'm very excited by all of these things because unfortunately in our society, many of our mental health patients are some of the most marginalized and isolated people in our community, and we can really make a huge difference for these people and their family and the entire community. The second one, getting better at this, good. The second one is seniors and chronic disease, and as has already been mentioned, this is the huge growth area in our community. I was reading some figures the other day that there are now more people over 65 in Canada than there are under 15 in Canada, and that's an actually very scary thing, and that's only going to get worse or better depending upon your point of view as time goes along. And we're going to have to start to take care of these people better and better. Again, we do it as right now in our hospital quite well, but as Altaf pointed out, we are under such space and resource constraints that a lot of it is sort of fragmented and in various different places. What the new hospital will allow us to do will be able to develop such huge programs that will be able to take care of some of these patients in a better way, with 8,300 geriatric outreach team visits, 4,500 nursing visits and 3,800 pharmacy visits, 7,200 diabetes clinic visits, and 5,600 cardiac rehab visits, just to begin and just to mention a few. I think what's more important, though, is we're going to be able to get specialized clinics. We know, for example, that 1% of our population racks up 35% of our healthcare costs. I know that's a very unbelievable thing, but it's actually true. And many of these 1% of the people are seniors. Many of them have got congestive heart failure or fall or end up in the hospital again and again and again. If we are able to get some of these clinics up and running and get them better than even we have today, we'll be able to make it so a lot of these patients don't come back to the hospital, are better cared for at home, are better cared for by their family, and have a higher quality of life. Because we all know that living older is one thing, but living older with a good quality of life is another thing yet again. In addition to that, one of the other things that the movement to a two-site model will allow us to do will be to be able to develop what we call light admission clinics. Many of our seniors need to be in the hospital for a little while to be taken care of for minor infections or other ailments, and now they just go into the generalized hospital. When they get there, they pick up diseases, they get sick, they often become more ill than when they first went into the hospital, and that results in a lot of problems. And in fact, more people, unfortunately, more seniors die in our hospitals than die of breast cancer in Canada every year, another sad figure. If we're able to take advantage of these lightly used clinics, we get people into the hospital, we keep them segregated from the patients who can make them even sicker, we get them better, and we get them out. So on these two major fronts, and there are many others, just by having a two-site model with the ability to have better facilities, with the ability to have better outpatient services and resources, will make a huge difference in our society, will make a huge difference in our community, and will result in us having a much healthier and a much happier community. Thank you.
So thank you, Dr. Strohs and Dr. Vidoris. That was an excellent presentation on some of our specialized programs. So this slide now starts to talk about the articulation of the scope of the two hospitals and the core services that will be at both sites. So as I said before, emergency, surgery, ICU, med-surg beds, and clinical supports will exist at both hospitals. And then the distribution of the specialized services will be as follows. Mackenzie Richmond Hill Hospital will focus on seniors and chronic disease, chronic kidney disease, complex care, and rehabilitation. And Mackenzie Vaughan Hospital will focus on district stroke, mental health, birthing, and pediatrics. Intake for all these services will occur at both hospitals, but as we've talked about earlier, the specialization of space and clinical content and the depth and breadth of services that can be provided by locating them at specific sites will provide world-class care and will provide the critical mass and the specialty of clinicians in particular that we need. So for example, geriatricians are very hard to come by. And when you have a larger program for seniors and chronic disease, we can recruit greater subspecialty geriatricians. Same thing with neonatology, same thing with stroke, where we can get more neurologists and even better neurosurgical consults. So this model will obviously facilitate those levels of subspecialty care that currently people go to Toronto to receive. And that's driven by the two-hospital model. Around the two circles, you see other services, and these are services that currently exist. I think Lou pointed out earlier, we have a number of ambulatory locations. So for example, we have two satellite dialysis centers, one in Vaughan and one in Oak Ridges. They will continue to support the two-site model. We have a number of mental health and behavioral services throughout the community, going as far as Barrie. Diabetes education is provided in Vaughan in an outpatient setting. Cardiac rehab is provided in Vaughan in an outpatient setting. So these services will continue to grow in those types of locations where it doesn't necessarily have to occur in the hospital. So this is the concept of core services and specialized services that would exist across Mackenzie Health through its system of service delivery. Now, preparing for the future really talks about working through the planning process. And I know we all wish the hospital could be here yesterday. I do as well, because we see the tremendous demand for services in the existing one-site hospital. The reality is we do have an approval from government. It was provided in July of 2011. The information on the right is actually the letter from the Minister of Health providing us with that cabinet approval. We have a hard fixed date for tendering the project in 2014-15, and our team is working very actively, and I'll give you some of the specifics of how much effort has gone in to the Stage 2 planning to date. I've shown this slide before, so this is the prescriptive 5-stage planning process that all hospitals must go through through the Ministry of Health. We completed Stage 1 in March of 2010. We are now well through Stage 2 and intend to complete that in March of 2013. So we are very confident that we're going to hit that timeline. And then Stage 3 is where we get into the real meat of the design development. So it's defined as blocks and PSOS. PSOS really refers to the output specifications for the tender documents. And that will really enable us to get the documents ready to tender, to go to market, which then gets us into Stage 4, which is the actual request for proposal, where the consortia will bid on the design build project for the Mackenzie Vaughan Hospital. And that will occur between September and August of 2015. Construction is expected to start in 2015. It's about a 3-year build, and our hope is to be operational in 2018-19. Now you see the two stop signs on the bottom that suggest requires government approval. The approval we received in July of 2011 provided both those cabinet approvals. So we do not require further cabinet approvals. We still need to go through each of the stages with the Ministry of Health, but the cabinet approvals are in effect in place. The levels of approval that we now seek are at the level of the Assistant Deputy Minister. So we work within the actual bureaucracy of Ministry of Health to get those approvals. So that's a very positive statement and ensures that if we can manage our local issues with respect to our requirements for local share and fundraising, really that's all that stands in the way of us moving this project forward. Now, stage 2 is probably the most intensive process with our staff. So unfortunately, we didn't give our staff much time off during the summer to keep the schedule for this project. So about 400 clinical staff, physicians, and other staff participated in what is defined as functional programming. It's defined by 39 expert user groups that are really the functions of the hospital. So a function would be the emergency department. Another function would be medical imaging. Another function would be the operating suites. So each of these user groups have been looking at what services would be delivered, how they would be delivered, how much space would be required, and the adjacencies of those space to ensure that the hospital would be efficient. So as an example, we know that about more than half of our patients who come to the ED require medical imaging. So you want imaging to be adjacent to the ED department. So those are the kinds of efforts that are going on to create, in effect, a space table that, in this case, will specify 1 million square feet of space in each of those functional areas. And it's a lot of effort, and our staff should be congratulated for giving up a lot of summer holidays to get a lot of that work done so that we can stay on schedule. So that program is nearing completion, and now the architects are taking that program and starting to assemble blocks of space on the lands that the city is providing. So we're very excited by achieving that step in the process. Now, obviously there is a huge amount of effort that has to be put in place by the community. And we're fortunate that we have a number of partners that are contributing dollars to this project. So the region of York is committing $152 million to Mackenzie Health for 2 sites. The Vaughan site is allocated $117 million, and the Richmond Hill site, $35 million. There's no project at the Richmond Hill site, so those dollars are obviously held by the region. We will be drawing upon the 117 from the region of York for the Vaughan project because it's approved, and we're proceeding with the region to secure those funds to move the project forward. Land is fundamental, and the City of Vaughan has provided that contribution for the Mackenzie Vaughan Hospital. And our foundation, and you can see some of the material behind you, Mackenzie Health Foundation is in the midst of starting to organize a capital campaign for the Mackenzie Vaughan Hospital. We have tremendous support from our politicians, and their support is actually provided through sweat equity. We make them sweat the last Thursday of every month at our board meetings, but they also put a lot of effort into our committees as well. So both mayors from the town of Richmond Hill and from the City of Vaughan, and regional chair of York, Chairman Fish, also sits on our board. And without their support and their guidance, we wouldn't be where we are today. Now, speaking about fundraising, obviously the foundation is key. Mackenzie Health Foundation, formerly known as York Central Hospital Foundation, has been in the fundraising business since 1977. They've raised over $66 million in support of the Mackenzie Richmond Hill Hospital, plus in many of our ambulatory locations, our diabetes education, our cardiac rehab in Vaughan, our satellite dialysis in Vaughan. So clearly, there's been ongoing support for equipment and physical expansions to the Mackenzie Richmond Hill site. Donations for Mackenzie Health Foundation can be designated to each of the specific sites or for any programs or services that the donor would specify for. Now, as we look forward, the task is quite daunting for the foundation. We are going to be looking at 2 comprehensive campaigns. The Mackenzie Vaughan campaign will be upwards of $150 million, and that is covering 2 components of fundraising. 100% of the medical equipment and technology has to be funded from local share, and 10% of the construction value. So the blended amount will be in the range of about $150 million when we look at the size of this project. over the next 10 years. At the same time, we need to continue to ensure that the Mackenzie Richmond Hill Hospital has the necessary equipment it needs to continue to deliver services to Southwest York Region. So there's a $50 million campaign, the first part of which is a $5 million campaign for a second MRI, which is currently underway. Our intent is to have that second MRI installed by the end of this year. If you came to the Mackenzie Richmond Hill site right now, you'd see a mobile unit parked outside. So that's our second magnet that we're running until the permanent one is funded for and put in place. So part of tonight is not just to inform you, but for you to get involved and to get your support for this. Because without community support, without your efforts, without your contributions and your input, we cannot get there. We have a very engaged board that provides community support. They are residents of Richmond Hill and Vaughan and the surrounding community. They are engaged. They represent you very well, and they put in a lot of hours and a lot of effort. We have a Citizen Advisory Council that we're about to start, so we encourage you to be involved in that as well. We ask you to invite us to your respective locations so we can keep you informed and share information with you. And obviously, our volunteers, and we have a number of programs there that also engage our community. So get involved, tell us what you think, and obviously, at the foundation level, please donate, and you can see the website there to get involved financially as well.
I'd like to welcome our newly elected member of Provincial Parliament representing Vaughan, Stephen Del Duca, to the podium.
Well, thank you very much, Lou. And I just want to begin by saying it's a real pleasure for me to be here with all of you tonight, talking about an issue that's, of course, near and dear to so many, if not everyone in our community, certainly most of our community. It's something that I heard about loud and clear over the course of my relatively recent by-election campaign. I want to say thanks again to Lou, to Altaf, and the rest of the team at Mackenzie Health for organizing tonight's open forum. But beyond that, also thank you to them and the rest of the volunteers and the board at Mackenzie Health for doing day in and day out a really exceptional job of making sure that this project continues to move forward, making sure that we continue to have the kind of positive progress that we need, getting us one step closer with each passing month to realizing our dream of having a hospital in this community, which will happen on time, as Altaf talked about a second ago. I want to thank all of you for being here. I see a lot of familiar faces in the room, but I also see a number of people that I haven't seen at previous forums like this one, and it's certainly a great sign. I think that we will all continue to work hard to make sure that we get the message out about how people can continue to be involved and be excited about this project. I think that's really important, so please continue to spread that message. I guess I'm also here really briefly to say, and Altaf certainly mentioned it in one of the slides that he had a few minutes ago, where he talked and showed the letter from the Minister of Health, that the Ontario government remains 100% committed to making sure this project moves forward on time, to making sure it gets built in a manner and in a way that's appropriate for the community and for the increasing needs that we have here in this community. And in fact, having been elected on September the 6th and being at the legislature just a couple of weeks later, on the very first day that I was in the House, I had the privilege of asking a question, and that question in question period was posed to the Minister of Health, and it was on this very question, this very issue, and she stood in her place, Deb Matthews did, and answered very unequivocally and clearly, reiterating her commitment, the one that she made on behalf of the government back in July of 2011, that this hospital is going to get built. So I was happy to hear that sort of on day one in terms of me representing you in the legislature. I think it's really important to stress, as we've seen here tonight, and we certainly see and have seen over the course of a long period of time, that these kinds of projects cannot get built the way that they need to get built without the cooperation of every level of government. And the fact that we have a mayor and members of council, many of whom are here tonight, who've been tending to this project every step of the way to make sure that we have the kind of local support and buy-in that we need, is something that makes my job as the provincial representative an awful lot easier. So I want to congratulate the mayor and the members of council and the rest of the staff at the City of Vaughan for being front and center and helping to make sure that we move this forward. And I guess, because I know the questions and answers section is coming up momentarily, so I'm not going to talk for much longer. But there is something that I do want to underscore in terms of its importance, and it's what Altaf said a second ago. The requirement for the local share is something that is necessary for every hospital project that goes forward in the province of Ontario. We are blessed because we live in a community like Vaughan that has an extraordinary capacity to accomplish great projects and get tremendous things done when we all work together. And we certainly have a very strong philanthropic, generous undercurrent that exists here in this community. It's kind of woven into our DNA. So I have no doubt about our capacity and our ability. What we really need at this point, from this point until the point at which this hospital's doors open, and frankly beyond, is for everybody who has the interest and the capacity and the desire to make this project real, to get involved and to work together and to be united in making sure that we get the job that needs to be done on behalf of the 300,000 plus people who call this city home, to make sure that we get it accomplished. I know we can do it. Certainly from my perspective as the MPP for this community, I can assure all of you that I will work as hard as I possibly can, as long as I have the privilege to serve you, to make sure that we get it done. So thank you again for having me here tonight. Thank you for being here tonight. I look forward to the questions and answers, and I look forward to working with all of you as we continue to make sure this project gets built. Thanks very much.
Thank you, Stephen. Mackenzie Health certainly appreciates the support of the Ontario government and your personal commitment to our project on behalf of the people of Vaughan. Ladies and gentlemen, this project is real and exciting, and we certainly look forward to seeing all of you at the opening of the new hospital in the city of Vaughan. I'd like to express our thanks to all of you who have shared questions, comments. My thanks to Mayor Bevilacqua, MPP Stephen Del Duca, Mackenzie Health staff and physicians for their insights. I just want to remind you one more time about helping us and providing us with as much input as possible by please completing and filling out those written surveys before you leave. If there are thoughts that come to you, on your way out, or even after this evening, please feel free to forward those to the hospital. For those of you who may still have questions, our speakers will remain here for a little while after the presentation, and you're welcome to speak with them individually as well. So again, in closing, I'd like to thank you for taking the time to join us this evening. We hope you have found our update helpful and informative, and that you please stay involved with Mackenzie Health as we continue to seek your support and involvement in the new Mackenzie Vaughan Hospital. Thank you very much.